How do you find the news when it comes to general practice and primary care? We got asked this question recently, and in this episode, myself and Andy are going to cover how we find news resources to cover for our regular update sessions that we do for you on EGP Learning and the EGP Learning Podcast, and how you might find similar sorts of information to help you understand and keep up to date with general practice news, views, and various other stuff that's happening around the world. Let's take enhance your primary care and learning. Hello, EGP learners. Welcome to this episode where we're talking about keeping yourself up to date with the news. What are you thinking about this, Andy?
Yeah, it's good. So we got asked a question, didn't we? How do we keep up to date? How do we generate topics for EGP Learning News Update episodes? It's really interesting. Before we start, I think it's important to say that we're not talking about how we keep up to date clinically in terms of regulations and developments in clinical practice. That might be another episode. We're really talking about how we know what is going on, or how we try to know what is happening in our industry, and maybe in a few examples in things that we're interested in personally as well. Yeah, really excited actually to talk about how you keep up to date. I'm wondering if it's the same or if it's different, really. But shall we dive in?
Absolutely. It was interesting when we started pre-talking about this, both me and Andy came up with slightly different answers. So hopefully we'll be able to cover a wide gamut of stuff that will be useful to you as an individual watching this or listening to this and stuff, but also sharing our little hints and tips of how to do various different parts of it as well. So where are we starting, Andy?
Yeah, so well, let's start with Google News. Okay, so I was having an interesting conversation with a medical student the other day about how I keep up to date, because I always ask them, how do you learn? How do you keep up to date? Because I like to learn from the young folks these days. And I said, well, I go on the BBC website and I go on Google News and say, oh, that's really quaint. That's really that you use the legacy news outlets. This person said, and they actually encouraged me to install Reddit. So I started to have a look at that, which I think we're going to be covering later on, which was a bit of a rabbit hole for me. But I've used Google News for a long time. What I like about Google News is that you can do little searches. So I'm in the habit of going into Google News and just sort of checking what it serves up for me. And then I just sort of think, oh, what's happening? General Practice UK. Let me put that in. And it shows you a selection of articles from the general news outlets, essentially. And there's some algorithmic magic happening to show you what people are looking at. I think that's one of the beauties of using a service like this is it's not just what is the cutting edge news or what people in your industry are talking about, but what are the patients, reading? What's the general population saying? I think all too often we can end up in bubbles, and I think this helps you get outside of your bubble in its own way. So you can do sort of search general practice UK, or you can get a little bit more technical. You can do sort of general practice Nottingham, and you like there are little commands you do when :7D means in the last 7 days. But if you're not sure how to put all that together, just click this little downward arrow, and actually you can put words in, and you can say past week, past different periods of time, exclude words, look at exact phrases. So it's really quite flexible, and I that's sort of become part of my day, really, just to run a few of my common word searches. One thing I would say about this is just beware of the algorithm. So there was a period where, just in terms of serving up my general news at the beginning, I'd started to get stories about Katie Price's mucky mansion. And don't worry, Gandhi, I'm not going to go down too much of a rabbit hole on this. But I think once or twice I'd actually sort of clicked on it. You see, I thought, oh, why are they sending me, serving this up for me to click? And the reason was because once or twice I had clicked on it, and I think maybe I just liked reading about Katie Price's mucky mansion, I guess. But it just started to come too often. So there is, it just thinks, oh gosh, there's an algorithm at play here, so just beware. But I think with the searches, you can escape that to a certain degree. So I really like Google News. Is this the sort of thing you use, Gandhi, or are you more like the medical student and more at the cutting edge?
So I'm learning a little bit from you, Andy, because I've never used Google News to search for news itself. I think sometimes I've ended it there by going through Google. So, I'll search for something on Google, but not specifically the Google News aspect of it. So I think that's really interesting. And particularly I like the way that you were able to filter out your search using the mechanisms. I thought that was quite nice, actually, because I probably wouldn't have used it in that way, but I think I might do from now onwards, because actually that was quite powerful the way that you found it.
Yeah, it's pretty cool. Yeah. I also was just going to mention just kind of standard news outlets. And I'm quite a fan, actually, of the BBC website, for example. And I like to check something like this every now and again, because If you go into social media or even Google News for a certain degree, they're kind of serving up what they think you as an individual might want to see. And I think the BBC might go this route in the future, but currently my understanding is they're serving up what they think is relevant for the population,
Yeah.
which I think is very different to what you get from some of these newer types of reviewing the news. So you get the same news everyone else gets from something like BBC. And I think actually that's quite important in modern society. And I think
Hmm.
it stops me getting too bubbled and other people getting too bubbled. And they've got, having a quick look at the health, section a few times a week is quite interesting, really.
Hmm.
So I use traditional news sources, not paper ones though, but traditional electronic news sources, a fair amount. Yeah.
I think it's interesting. So BBC Health is obviously one of the big ones. There are obviously other major news outlets that do cover a lot of them. There's things obviously like Sky, the Daily Mail, which I would never go to in terms of news coverage and stuff. But Guardian, other kind of the traditional news outlets with their own health kind of spin on things. And like you say, it's useful to know because that's actually what probably a lot of our patients are looking at. So potentially judging what might be coming through, and we're going to talk about some other ways you can do that later down in this session. But what are the patients coming to us with? That sometimes having a heads up on that could be really powerful and really useful and stuff.
Yeah. They do a good job of reflecting what the general population is
Yeah.
thinking, or taking a broad view of that. So on issues like the strikes, which we have been covering more recently, actually just going to mainstream media outlets as well as our industry outlets is quite useful to
Mhm.
get a good perspective on an issue that might be a little bit controversial. So that's
Okay.
where I get value from that.
But then if we're going a bit further down and a bit more specific and niche, then we probably do want to talk about the industry news outlets. And we're going to talk about three of the big ones that many people may have heard of. So there's Pulse Today, which is a traditional general practice news outlet, GP Online, and HTN, the HTN, which is obviously one we've worked with in the past and stuff. There are a couple others, and we're going to talk about another one later on in this session. But these are the available news resources that focus very much on healthcare, general practice, that kind of stuff, and they have lots of information and really good for getting that detail as to what might be coming up and stuff. So we've got Pulse Today coming up right there that you can see. We often cover them for our news updates in terms of their articles, because actually that's the kind of news that's relevant to us in general practice, isn't it, Andy?
It is, yeah, and the standard of the journalism in these outlets is normally pretty good, and they link across to other articles that they've done, and they link out to other sources, which is really, really helpful if you want to dig a little bit deeper into one of these stories. GP Online is really good as well, and they often cover a slightly different story mix to Pulse. And then for something a deeper or a more niche topic like health technology, something like health
Yeah.
technology news, HTN, is really, really good just for putting that information together. So those are really, really useful sources, I think. So yeah, anything else that you also use, Gandhi?
I think when it comes to this kind of niche area, and probably not apart from the one we're going to talk about a bit later on, but we'll come to that one later, because these are obviously free ones. You don't necessarily have to pay to use and that kind of stuff.
Yeah.
But there are some other outlets and stuff that have a different model in terms of how you access their information. I guess one of the things that some of these outlets have looked into are podcasts as a way of keeping you updated. And actually, many people of our AGP learners know that you and I love doing podcasts because we create one. Our update episode is a podcast that you can listen to, and really useful sometimes to get that information. And I listen to a couple of podcasts, particularly for information about what's been going on in general practice and the NHS in particular, and more importantly for the perspective that you get with that and stuff. So there's some really cool ones out there. I'm really a big fan of the MP Medical one. So although they focus a lot on the guidelines and that kind of stuff, the first part of it is always just a commentary of what's been going on in the NHS.
It's quite playful as well, isn't it? And a little bit more light-hearted. It's not all
Mhm.
not all doom and gloom, although some of the topics covered can be negative.
Yeah.
But yeah, I like the MB Medical one as well, actually. It's really good. I think that's something you find with podcasts, actually, is whilst the mainstream news outlets, it can be quite demoralizing to spend time in that space. And I think that's because they get eyeballs by being dramatic or by being negative in a certain way. That's what drives eyeballs, and that's their model. Whereas I think with podcasts, they're generally more catering for a niche. And actually, a podcast, if it's going to be 20, 30, 40, 50 minutes and it's negative, that people just aren't going to listen. So I think just by virtue of the platform, they're a bit more positive, they're a bit more uplifting. So I quite enjoy all sorts of different podcasts, actually. So
There's a
it's
really
a really
interesting one I listen to that's very much around commentary, and that's the one called Two Medics and a Mic. So it's by two hospital-based doctors who comment on what happens on Med Twitter every week. So it's slightly delayed because they cover the previous week's stuff. So, you know, depending on when you catch it, it may be slightly out of sync and stuff, and very much their perspective. But it's a really interesting listen, and I tend to listen to it on a Saturday when I've dropped the kids off at their religious classes and stuff, and I've got a 40-minute drive home afterwards. So actually, I find that a really good time to listen to that and get through the episode and catch up on what's been happening in the wider world of the NHS. Because obviously we're very clearly in tune with, I think, with general practice, but sometimes knowing what's going on wider than that can be quite useful. I find that a nice way of finding out.
So Gandhi, what you're describing is sort of mixing business and pleasure in a way. So it's quite entertaining, but it's also informative. And I think that's what podcasts are really good for, actually. And also you're doing it while you're driving as well, which I think podcasts are really good for doing while you're doing other things. So I listen to podcasts when I'm walking the dog, or doing the ironing, or doing boring things around the house that don't require much concentration. And it actually makes those things a bit more pleasurable. Actually, I sometimes look forward to doing those things, which might be a chore, because it gives me permission to listen to a podcast. So that's really good. Yeah, I suppose
absolutely. And absolutely, if anybody does want to listen to our podcast, the EGP Learning Pod Blast, if you just want the audio version of it rather than the visual aspect as well, then definitely do subscribe. We're on Apple, Google, Spotify, everywhere and stuff. So just type in EGP Learning Pod Blast. If you really want to get the specific one, type in Buzzsprout, because that's where it's hosted and stuff, and that'll take you straight to it, so you can listen to our content whenever you choose. What's up next, Andy?
Well, I'll say the other thing that I do, which again is probably a bit old-fashioned, really, is email mailing lists. And you can definitely have too many of these. And there's a process that I go through periodically where I just unsubscribe from all of the ones that I seem to have accumulated, and ones that I don't even know that I've subscribed to. But I do keep a few there. So I like our local LMC emailing list, for example. I think that's quite good for local issues and highlighting some of those BMA kind of issues that come through. I quite like the Pulse mailing list, for example. So I just keep a few that I subscribe to, and then it just gets a bit of news into my workflow, just to at least have an awareness of the headlines. And I think that that's really useful. A few actually podcast mailing lists, podcasts I follow, I've subscribed to their mailing lists, and that's quite useful as well. Like Medics Money, for example. I just find I've got a bit of a weird interest in personal finance, Gandhi, and I just like to see a little bit of that news in there.
Keeping on top of your finances is really important, particularly when we're in the middle of a cost of living increase crisis and stuff.
Yeah, absolutely. Yeah. Any mailing lists that you subscribe to that I've not mentioned, Gandhi? There must be some, maybe. If you go for
so it depends on which parts of my life we're talking about when we talk about general practice and stuff. So you mentioned the LMC, and I think that's a really good list for most places to be signed up to, because that will obviously give you the information locally based around general practice and the information. I think you're talking a little bit wider. So as an RCGP member, I get the RCGP newsletter every couple of weeks, whether it's the chair's blog or whatever, and that kind of stuff. And obviously that has an interest that I have from that point of view. I think when we're talking wider, I tend not to subscribe to the news outlets because I tend to go there myself organically anyway. So I don't feel the need for getting their email list on top, because I just end up deleting because I already read the news, because obviously that tends to be a bit more retrospective. But again, particular voices that I listen to, I do stay on their mailing list. So friends of our podcast, so Dr. Rachel Morris, who does the You Are Not a Frog one, Tara Humphreys, who does the Business Healthcare podcast, and Ben Gowland, who does the General Practice podcast. Although I listen to their podcasts, actually they also provide additional information in blog format that sometimes you don't capture through the podcast. So seeing that is quite a nice way, and it sometimes reminds me of some of the episodes I may have missed and stuff, and content that's relevant. So I do keep in contact through those as well.
Yeah, really, really agree there. So, and Gandhi, you're much more in tune with social media than I am, and I can see on our prep list a few of the next ones are social media type topics. So, just talk us through what you find useful, and maybe why and how you find those things useful, if you don't mind.
So I think when it comes to social media, there's various different categories you need to think about, because you can't just think of social media as one thing, because they're all accessed in different ways. First one I think I'm going to mention is probably one that's intrusive on virtually everybody's life, and that's actually WhatsApp. WhatsApp groups are endemic, I think, or pandemic, or whatever word you want to use for them and stuff. But they are actually a method that many of us keep up to date, and in particular news. Obviously, during the height of the COVID pandemic, loads of WhatsApp groups were created to help coordinate responses, keep people updated. We had one for our practice, we had one for our region, we had one for the PCN, we had one, various different ways, and it's a really good way of sometimes sharing information, getting contact, and making connections and network connections with other people as well, because you've got that direct contact. Can be really useful in that sense. And I know that often there's pieces of information that get shared so much quicker through social media because it's so live and so up to date, that actually often some of the other news sources we talked about, I will hear about them through these connections far quicker than I will through mainstream or even niche media and that kind of stuff. So I think for speed of information, sometimes they can be really powerful. The contrast with that, though, is obviously sometimes the information may not always be reliable, and there's that element of double checking what's come through or what's being shared and that kind of stuff as a result of it, that is sensible news sourcing, shall we say. What are your thoughts, Andy, on WhatsApp groups in particular?
I was just going to come in on WhatsApp in particular, because I think that's something that's been somewhat new the last few years. The other social media platforms or the other social media formats have been around for a lot longer. And I think that they're quite powerful, actually, because I guess what people are doing is they're sharing with a known group. It might be a big group, but they sort of know who all the type of people that are in there. I think that means the sorts of things that get shared can be a bit more in that more trusted information kind of area. It might be things that are not released yet, not known yet, and that means that the value of being in these groups is higher. So you kind of want to be in them and engaged. And there's something about being part of a group which is really useful, and people are a bit more willing to share things because it's not a kind of a broadcast social media where really anyone can see it, like your Facebooks or your Twitter. It's more of a trusted group. Got to be careful of leaks, and a lot of people have fallen foul of oversharing within WhatsApp. But I think it's really powerful. It offers something new, I think, to the other social media platforms. So these kind of group sharing mechanisms, I think, are really powerful. Yeah.
And as you sometimes, because you find information through that route, you can actually then have an element of understanding about that kind of content so much earlier. So often a lot of the letter deep dives that we have done are actually from letters that we've received through these groups, and then actually it's gone mainstream probably the day later or something like that. So we've actually had a bit of time to process and understand it so that we can hopefully digest that more effectively and stuff. So there is a value of being part of those groups. The clear challenge is overshare being an issue, and the problem is when you're in lots of groups, you get the same content about 10 times as well, because it's suddenly gone through the sharing tree, as I like to call it, as a result.
It's so easy to forward, isn't it? But that that's a feature as well as a bug, I guess.
So we talked about WhatsApp. I guess other social medias to talk about. One I often comment to many people is Twitter. I know Twitter's had a bit of an interesting name recently because obviously the purchase by Elon Musk and the impact that's had, and as a result of it, how much more valuable is that to continue to be? For me, it's still a very valuable source of information. I find out a lot of my general news through Twitter, but you do need to be aware of how to use it a little bit more effectively, I think. So Andy, you mentioned the algorithm, how the algorithm will select information to share you based on your interests and what you clicked on and looked at and that kind of stuff. So being aware of that. So often I think what a lot of people don't realize is that when you click on the trending stuff, the first thing it will show you is trending for you, which is then a curated list based off your preferences by the algorithm. If you actually want to go to trending, as in what's generally trending, you have to click on the next tab, which is a slight nuance that a lot of people don't realize. So then you tend to get stuck in your little bubble. And then that information may not always be as pertinent because it's not trending for everybody, which is what you mentioned, like things like the BBC Health website and stuff will do, versus what's trending, but in your little bubble kind of thing. Does that make sense?
It does. So you just need to be aware of this so that you're aware that you might be in a bubble and take measures to look outside it. I think that's the key thing here. So so Twitter's really good. I dabble on and off a little bit with Twitter, although in 2023 I want to be a bit more present on Twitter because I appreciate that it's still, there doesn't seem to be anything quite like it in terms of you can broadcast to everyone in the world and everyone in the world can see that and interact with that. And just like WhatsApp has its own unique mechanism, I think Twitter is kind of unique in that, or at least being a big group of people with a big network effect that does that mechanism. So that's really interesting. Facebook, I guess, is the other big one. Gandhi, in some ways, sort of feels a bit old-fashioned. Lots of younger people moving away from
Yeah.
Facebook. But what do you think about Facebook, and I guess LinkedIn as well these days?
Yeah, so I think thing with Facebook is more around the group kind of mentality. So it's a hybrid, I think, of what WhatsApp and Twitter are effectively currently. You're right, the audience is the interesting thing to be aware of, and there are some really large Facebook groups that both you and I are part of. In terms of there's the classic ones when you can talk about general practice. You've got GP Survival, Resilient GP, TCOs, that kind of stuff. You've got more topic-based ones. So I obviously run the System One Facebook user group. Part of other groups, one about GDPR, one about training and that kind of stuff, and that has value, and that shares more niche information, which is a really good way of sometimes sourcing information. Important to remember, you're at the mercy of the algorithms again, so they will show you what Facebook thinks you want to see, and similar to LinkedIn to some degree, although LinkedIn's more business orientated and stuff. So just being aware that information may come, but I tend to find that information is slower than the other routes. So definitely, if you're talking speed of information and stuff that's come up, your WhatsApp and your Twitter far faster in terms of sharing that kind of information. Whereas things like Facebook and LinkedIn, you're talking news that's come out a day or so behind, unless someone's really been hot on it and shared it, and you just happen to see it at that point and stuff. So just to be aware that the news tends to be a bit slower in those kind of environments, from my experience.
Yeah, I think with Facebook, I think it is really good for organizing a group, and I think it's still really good for that. I don't think there's much coming in to challenge that in terms of kind of acting as a person, or a personal individual within social media. I think I've kind of moved almost entirely away from Facebook for those sorts of interactions. Should we talk a little bit about Reddit, Gandhi? So this is what the medical student said. No, don't use Google.
Tell us about Reddit, because I don't think a lot of our colleagues out there will know what Reddit is. I do, but go for it.
Well, okay, you're testing me here, because I still don't know a great deal about Reddit, but it feels a lot more like, in some ways, quite old-fashioned, like kind of old-fashioned bulletin board type thing, back when the internet was really, really quite new, where people post a topic, and there can be subtopics, and people just post within those topics. People comment on the posts, and based on the level of interaction these posts gets, it kind of gets more visibility within the platform. I guess it's just managed to attract, from my impression, a lot of communities around certain topics. So it's kind of really good for let's say communities rather than groups, which I think is where Facebook is at. Kind of Facebook feels more like organized groups where there's some connection outside of the social media platform. And Reddit feels a bit more about communities based around topics, and you can get it can get really, really niche, and it can get really, really interesting. And I think some of the kind of junior doctors activity can take place on Reddit. I think it happens quickly as well, so you can get a lot of momentum behind things. People might have heard of Reddit in the last year because of the Wall Street bets kind of stock manipulation that was happening with groups of people coordinating to buy certain stocks on the American stock market and manipulating the price. And fascinating. I think there's a documentary on Netflix about it, which is pretty good. But what's your feeling around Reddit, and I guess in particular around medical kind of news?
Yeah, so very much it's the old-fashioned discussion board kind of forum, but it kind of went for quite a while with Reddit, and then it's definitely had a renaissance more recently. And I think part of that is because of the fact that Facebook groups have very much lent into the algorithm controlling what you see, whereas in Reddit, because there's the upvote mechanism, you can actually it's more community led in terms of what information you see. There is still an element of an algorithm. There always will be in social media platforms and stuff, particularly centralized ones and stuff. And that's why particularly we've seen an increase in use of decentralized social media platforms. So things like Mastodon, which I've talked about a few times as the alternative to Twitter. There's similar things for the kind of Facebook and that kind of thing as well. But it's got the community. So I think the Junior Doctor Forum is something like 20,000 members or something, quite significant, maybe even more actually. I might be getting that wrong with some of the other forums, but some of them have millions. Like the medicine one has a million plus members. Now, how many of them are live and current, harder to judge. But you can search a lot more effectively. You can add what's called flares onto topics, which is basically creating a topic within different sections, so you can find them easier to search for. You can upvote comments, so make the popular comments more prevalent, that kind of stuff. And there's a bit more of the monitoring. Sometimes it can be a bit cockpit-ish. I think for some of our more seasoned listeners, the doctors.net forum may ring some bells. And I think it's still open, actually, although I don't know how many people are in there, and I wouldn't really use it as my source for news, but definitely I know there are people still in there for community, although I think many people may have moved on to other places, like particularly Facebook and possibly even Reddit and that kind of stuff, for their news side of stuff, or community even. But yeah, that's probably the best way of describing Reddit itself as a platform.
It's really addictive, though. I would encourage people to download it and have a look. And certainly for your kind of personal, outside of medical interests, it can be just really, really interesting way of discovering content and information and opinion. And it's a lot more addictive than you might, think, based on its description as an
It may not
old-fashioned.
be a good thing. We
Yeah,
do need to give a
I
caution.
deleted. I deleted it.
Trying to keep you in the
I
environment, and therefore can become quite addictive and stuff.
Yeah, I got rid of it from my phone, Gandhi. I was interacting with it too much, so got rid of it. So yeah, so Gandhi, we get a large part of what we do is on YouTube. We provide news. So other people, I guess, must be providing news or opinion or commentary on YouTube. I mean, what do you feel about the role of YouTube in your discovery of information and news?
So I think when we talk about information, absolutely, YouTube is probably one of the best ways of finding out information of stuff. Generally speaking, if you want to know how to do something, you will often now YouTube it, won't you? How do I fix this? How do I do this? That kind of stuff. That is YouTube. News, interestingly, so it has its own news bulletin. When you go on the homepage of YouTube, it will often show you what's trending, and sometimes that can be new stuff. So weirdly, I've ended up watching PMQ, Prime Minister's Questions, on YouTube quite often on a Wednesday, because just before I start my clinic, I will log onto YouTube, do some of my EGP learning work, and that happens to coincide with the Prime Minister's Questions. So I've ended up watching it a few times because of the fact that it's, whilst I'm doing my background work before I start my clinic and things. So it's really weird how sometimes it can work as a news resource, and it does have.
I've never done that, Gandhi. I've never clicked on the news. I'm doing it. I'm logged in as myself, so let's be careful what we should. I look at very boring things here. So okay, that's really interesting. And I guess they have a different news channels, and one of them will be health, I guess, or we can. That's really interesting. BioNTech cancer vaccines. So this is good. So I guess it's sort of doing what Google News does for textual news stories, but for sort of video based news outlets. So that's really, really interesting. I'll be giving that a bit more of a go, Gandhi, over the next few weeks. That's really helpful. Good. Yeah,
I think it's important to remember when you're talking about general practice specific stuff. To be honest, it's me and you on YouTube when we're talking about that kind of news.
Yeah. Well, which is good for us, I suppose. It's good. Yeah. YouTube is quite magical. I always liken YouTube a bit to the Matrix. When they say, "Oh, I need to know how to fly, a Black Hawk helicopter," and they kind of send the information to their brain. It's almost like you can say, "Oh, I need to work out how to stitch audio together on DaVinci Resolve. Can you tell me, YouTube?" And then you watch a video in 5 minutes and you know how to do it.
Finds
It's magic.
Yeah, I think one thing before we go on to some of the other topics that is worth talking about, and there are various local, I think, versions of this, and I think one that we didn't talk about before when we started creating this, Andy, which I'm going to chuck in, is things like TeamNet and other kind of local resources that you have. Different areas are going to have different resources that they use to share information locally. So it could be GP TeamNet, which I think is now called Aquilo TeamNet or something like that. It could be Practice Index, other kind of resources that share that information locally. I mean, we talked about email lists, so you'll have some from your ICBs and that kind of stuff. But these can also be ways of sharing information. Some of them have news feeds built within them. So TeamNet, for example, for us, we can get news feeds from different departments that shows in your TeamNet page that you may log into and stuff. So that can also be useful ways of you getting information and stuff that we didn't cover. But you need to be part of that community. And obviously that can either be provided for you, or you could pay to be part of a community, couldn't you, Andy?
Yeah, so just on TeamNet, the interesting thing with those sorts of services, and they'll have different ones in different areas, is there is some value in an awareness of what other people think you should know about.
Mhm.
and we're sort of verging into that kind of sort of CPD, keeping up to date for clinical practice area a little bit. But there's value in what the algorithm says you might be interested in, or what you are seeking out in your niche community. There's value in terms of knowing generally what everyone is seeing in terms of news, and then there is something about what do people think you should know about, and I think that's where things like TeamNet come in, and I think that is important for keeping appropriately up
Mhm.
to date. Paid for news, yeah. Do you pay for any news, Gandhi? We used to pay for news in the past, and then it was all
I
advertising driven, and then now some bits are behind paywalls again. Do you pay
Yeah,
for any news?
I cannot remember the last time I paid for news.
Okay,
Simply put.
that's interesting because I'm different. So I have a subscription to The Economist because not necessarily for keeping up to date medically wise, although the medical reporting in The Economist I think is generally quite considered and of a much higher quality than in the general media. But I always enjoy reading their articles. It feels like a bit of an advert here, but they're quite short. They're well considered. They're always well researched, actually. So they tend to do good research, and you get an opinion. You get
Yeah.
analysis with an opinion, and I know that comes from a sort of classical liberalism kind of perspective, and I factor that in when I listen to it. And I don't always agree with the narratives constructed, but the analysis is really good. So I'm kind
Mhm.
of willing again to pay for news, but I think there was a long period of time where I thought I'd never have to pay for news again in my life,
Mhm.
and now I do. So it's interesting. Yeah.
Well, I think it's the access to the voice, isn't it? Sometimes, like you say, it's the opinion and the analysis and that kind of stuff, and the promise of what you're getting that you may potentially want to pay for. So, you talked about The Economist in terms of obviously, from that financial and economical view. I guess when we talk about healthcare, there's the HSJ, I guess is one, the Health Service Journal, which is probably the leading paid for news provider in this space. It's not one I've ever paid for, partly because I find it a bit too expensive for what I would need, and I often tend to find the information through different routes. But absolutely, the voices speaking from it can be quite powerful in terms of the information they share
Yeah.
and trust in terms of what they provide.
Individuals probably aren't paying the subscription. That's the thing.
Yeah.
It's probably their organization, and that's why the pricing is pitched in that way. The other thing I like about The Economist is it's curation. So
Mhm.
they are kind of picking the stories and topics or kind of in-depth trend analysis that they think is significant. So you're sort of
Mhm.
paying for the curation a little bit as well. So that's interesting. Maybe in a year's time, if we revisit this, maybe we'll find you're paying for some news.
Maybe.
Who
Interestingly,
knows?
you talk about curation. There are various tools and tips and things that you can use to help curate the sources of news. So we talked about obviously various different ways where you can get electronic information about news and stuff, and actually curating that using various different apps. So Flipboard was one I've used for many years
Mm.
on and off. I kind of go back and forth
I
towards
used it for a
using
while.
it.
Yeah.
Yeah, and there's various other ones that you can use. I think even Google News can be integrated to do some of that. There's News Now, which is a nice, interesting way of using what was the word RS feeds to bring information to you. Although a lot of the internet infrastructure has moved away from using those kind of RSS feeds as a method of bringing information. But when I started talking about EGP learning, about 10 years ago, actually RSS feeds were the best way of getting information towards yourself from various different news resources and stuff. So there are other ways you can now do that using more
Just
modern architecture and stuff, but they are a good way of collating and bringing that information towards you rather than you having to go to all the various different sources to find them, and then obviously you can then deal with it from there.
yeah, just talking about curation, it's just made me think about the concept of just this information diet concept in terms of if you if you consume a lot of low quality calories and food, you're probably not going to be in very good physical shape. And I always now I'm a little bit more mindful about the type of information sources that I'm setting myself up to consume, because if you consume a lot of low quality information, and this I think is a problem for certain categories of patients, as well as professionals, then that can affect your thinking, what you think
Yeah.
about things, how you behave, and the types of decisions you make. So I'm trying to be a bit more mindful about my information diet as well as my physical diet. So it's an interesting concept that I came across in the last few years. I think is quite powerful, really. There we go.
So we've talked
So
about a lot of different ways that you get information, Andy, but I think we've forgotten one. What might that be?
sometimes, and we used to do this more, we talk to individual people in real life, and they sometimes tell us things.
Yeah.
Or we talk to individual people on the telephone, or we talk to them, in video meetings, and so forth. That's another way that news and information spreads, and you normally get it because the other person thinks it's important because they've, because
Yeah.
they've made a special effort to tell you about it. Quite a high energy cost to telling one person or a small group of people individually, but that's one way that useful information and news flows. And I often at work, I'll ask the students, and the staff and the receptionists what they think about certain things, and sometimes that's when you get some really useful insights,
Mhm.
even into the content of it, or just what different types of people are thinking. So, you can kind of test your own thinking, and sometimes you find that something that you believe, is and you think um, is correct, or right, or the right thing to believe. You get some pushback or some challenge, and you find, and it really questions what you're makes you revise your opinion on things, and that's really, really powerful. So I think discussion about information, and in particular, there's something about face-to-face discussion, which I think is particularly
Yeah.
special. So let's talk to each other about the news as well, face to face, and the coffee room at the GP practice is a great place to do that, I think. So I
Mhm.
thought it was important to include face to face as well. I think we both did. So
Absolutely. It has a different type of value and a different type of connotation, I think, sometimes when you have those more personable talks, whether it's, over the phone, one-to-one, or face-to-face in the presence of each other as well, can be valuable. So, not to forget, that's a way that we do capture information. I'm sure many people out there do share information with each other and stuff. And if that is the case, feel free to share this information with your colleagues, either face to face or remotely, or email them or tweet it to them or WhatsApp them and stuff about particularly the EGP Learning
or post it
channel
on
that you
Reddit.
can get all of your news for, if you don't want to go and do all that yourself, because we'll do it for you. And for that reason, absolutely recommend that you subscribe to this podcast and YouTube channel, whichever way you're listening to our content and consuming it and stuff. Leave us a like if you found this episode useful, valuable, and if you want us to do more of it, let us know in the comments as to what type of information you would love. And we'll be back as ever to help tech enhance your primary care and learning. We'll catch you in the next episode.